Welcome to part 1 of a story about Brody. Brody is an 8-year-old Plott Hound. He's on the right in this picture. In October of 2018, he injured his right knee. After x-rays and consulting with the vet, we decided not to pursue surgery, even though it was determined he had a serious CCL injury. 2 months later, in December of 2018, he injured his left knee in very much the same way. The reason we wanted to document this journey is because we know how scary it is when you see your dog not able to move either of his back legs. You're very emotional. Your mind starts wandering to whether is he going to be able to recover from this. So we wanted to document our journey so that you could see there is hope. There's large dogs that injure both knees and recover without surgery. The Plott Hound breed is an interesting dog. It's a North Carolina state dog. It's trained to tree bear and hunt wild boar. Here's a quote that I thought was cool. It says, "They are the ninja warriors of dogdom, bred to track, run down tree, and if necessary, grapple with a baying 500-pound bear 8 times its size." That's from an article on Slate.com called Great Plott. Another from the American Kennel Club. The Plott, a hound with a curious name and a unique history, is a rugged, relentless hunting dog who is a mellow gentleman at home, but fearless, implacable, and bold at work. This is back in 2009 where it all started. We were living in North Carolina. We adopted him. He was probably 3 to 5 months old in this picture. As you can see in this video, he's super active. He's not much different now as an 8-year-old dog as he was in this. He just loves running around and being active. And he's playing in this mud puddle. This is typical bro behavior. He just loves the water. We have a pond where we live, and it's about 50 feet across both ways. And he just runs in a circle for hours in the summertime. Here he is at the beach. This is 2018, probably February or March, because it was pretty cold out. So you can see he's still getting around really well. So in 2014, we adopted Opal after we had moved to Virginia. So again, they're not related, but they are both Plott Hounds. So here's some quick stats about Brody. He's 90 pounds. Diet, right now it's 90% raw meat and bones. In the past, we have fed him kibble. For the last couple years, we would give him kibble in the morning and then either raw meat and bones or canned mixed with some kibble at night. Some aliases, because every dog has to have a bazillion nicknames. Bro, Broder, Beeb, Beebers, Beedoo, Brodeo, Sheriff Brody. Brody got his first knee injury in October 2018. It was his right knee, and we're not sure how he did it, but he couldn't put any weight on it, and it was obvious he was in extreme pain. After comparing some videos we found online to the symptoms that Brody had, we were pretty confident he tore his ligament in his knee. We did take him to the vet. We got x-rays. They prescribed him pain pills. The x-rays showed a lot of inflammation in both knees. He didn't say outright it was torn, but he said the right knee was a serious injury to the ligament. They also said there was arthritis in his hips. Because of the arthritis and the state of his knees, they said surgery is probably not the best route. In retrospect, because he ends up hurting his left knee 2 months later, we felt that we weren't diligent enough reducing his activity when he had only injured just the one knee. So if you're out there and your dog has just injured one knee, get serious about restricting his activity because it can make a huge difference. He will overcompensate by putting more weight on his good leg, and that one has a tendency to go out as well. This video is from about 2 weeks after his first knee injury. As you can see, he's back to being happy, but he's obviously in some pain, and he's limping around, putting most of the weight on that left leg. And I'm not sure if it's if part of the problem, but you can see his left leg is kind of turned out a little bit, and that might be a result of overcompensating, because it's the only leg he's using. That brings us to December 2nd, his second knee injury. He tried to jump up into the back of a car and slipped, and his left knee sustained a very similar injury as his right knee. We were convinced it's the same ligament tear. We talked to the vet, and he re-looked at the x-rays and said, yeah, the other knee actually did have a lot of inflammation. At this point, we were very scared because, he's only 8, but now he can't even move back both of his legs. I started researching non-surgical recovery like a fiend, and I felt much better afterwards because there's big dogs out there that get these injuries and recover. Here's a video where he goes out to pee. This is a day after his left leg injury, his second one, and you can see he can barely move those legs. Again, watch, he's just kind of figuring out how to pull his legs and hobble forward. Here I'm using ground beef to get him to lean forward and move around a little bit. We wanted to keep him moving a little bit because then it's, he gets used to getting up to go outside and stuff. So I would use ground beef and sort of pull it away and just get him to stretch out a little bit and just move a little bit of movement for him. The next thing you'll come across when you're trying to help your dog with this injury is how do you help him get outside to go to the bathroom if he can't move both of his legs? If you're researching knee injuries for dogs online, you'll come across a towel sling. We ended up using this fleece microfiber blanket. It's really soft and it has a little bit of elasticity in it. So it worked a lot better than a towel. The towel's a lot bulkier and hard to hold with one hand. Here you can see I'm using a towel and it's just kind of awkward. The other thing to note is that I'm walking behind Brody. It's easier if you're walking on the side of him. If you're walking behind him, it's just so awkward because you're not really leading him, he's leading you. We also came across this idea of using one of these shopping bags. You cut the sides and you create a sort of a harness that you have handles for. We used it once, but it was just too small and it wasn't good for a big dog with a lot of weight. When he would go outside, he would get so tired from the pain, he would just lay down. So here I'm trying to get him to go inside. I pick him up, and then I keep some weight, I keep weight on my arm while I put the towel in. And then, I can pull up a little bit to give him some relief from the weight on his knees. As you can see here, I'm still walking behind him. That was not the best way to do it. It's just awkward. You don't want him to be guiding it. You want to be the leader here. Again, I'm walking down and I'm guiding him to the place. So this was the end result. One person hold the leash and the blanket. Don't try to get your friend to hold the leash while you hold the blanket. It's just too awkward. My wife had the idea to use the planter, the wood beams, to allow him to squat down to try to get him to poo because he hadn't pooed in like 2 days. So we got him to lean back on this, and he found it really comfortable because it took the weight off his knees and he would just sit there. But it didn't end up making him go to the bathroom. He didn't end up pooing until the next day, later in the evening. Another tip here is we put our bed in the living room right by the front door so he didn't have to move around too much. This is a coffee cup my grandmother got us. I love Plotts. So that's it for part 1. I hope you found this helpful. We'll follow up with some updates as we move forward and, cross our fingers and pray for the best for Brody. All right, thank you for joining us. Bye.